Hello everyone. Welcome to the second session of Oncology Loves Neurology. Today I have with me Dr. Divya Madan. She's my fiance and she's currently pursuing her MD in Pediatrics from SMS Jaipur. And in this session we'll do a little bit about paraneoplastic syndromes that involve the CNS that can be asked in an entrance examination. So, hi Divya.
Hi.
कैसी है? So let's begin. So the first syndrome that we want to talk about is the OMAS, and now Divya will elaborate on that.
OMAS is opsoclonus myoclonus ataxia syndrome. The name itself tells us what it is. Opsoclonus means there would be saccadic movements of the eyes. Myoclonus means jerky movements दिखने रहे.
So the
Jerk-like
jerk-like movements of your upper or lower limb, for that matter of fact. We all know what myoclonus is, for that matter. Yeah.
Ataxia, that is the instability.
The gait instability.
Gait instability. The mother might say that the child is clumsy, falls here and there, doesn't walk in a straight line. So all these includes OMAS, opsoclonus myoclonus ataxia syndrome. That is common in
Neuroblastoma. So you should always remember that the most common cause of OMAS, this is opsoclonus myoclonus ataxia syndrome, as she described. There will be saccadic movements of the eyeball, will have myoclonic jerk-like movements, might even have other forms of seizures, for that matter of fact, and have an ataxia-like presentation. It's the most common cause in 50 to 60% of the cases. You will end up, or in sometimes some series say even on 100% of the cases, there is a neuroblastoma that is causing all this. So if child has child has OMAS, it is imperative to work up for neuroblastoma. You should do an ultrasound abdomen. If ultrasound abdomen does not reveal a mass, an MIBG or a PET scan is a necessity. In fact, we today have a child who was admitted, in fact, initially under neurology, and later it has been shifted to neurology, and we are the oncology. I'm sorry, and we are now the treating physician of that person. So that is about the OMAS syndrome. The second one I'm talking about is the NMD encephalitis. Now, Olivia will elaborate.
NMD encephalitis is an autoimmune encephalitis. It is usually seen post vaccination or few weeks after any respiratory tract infection or some minor viral illness, right? They will give a typical complaint that the child कुछ खांसी जुकाम था 1-2 हफ्ते पहले या इन्फेक्शन था यूटीआई था कुछ भी इलनेस देंगे 1-2 हफ्ते पहले and उसके बाद the child suddenly now has seizures or some abnormal behavior, or this could be post vaccination. So it is an autoimmune encephalitis, and mostly the complaints that the parents come with are behavioral change, sleep-wake disturbances, and dyskinesia.
So, as the name suggests, it's NMD against the NMD receptor. It is an autoimmune encephalitis. The treatment will, as I'll tell you, it will involve immunosuppression with steroids, IVIG, immunotherapy, for that matter of fact, pulse steroids, methylprednisolone. What is important to remember, it can be a paraneoplastic syndrome of teratomas, especially ovarian teratomas in females. Adolescent female, if you have someone with NMD encephalitis, or post-adolescent female around in the age group of 20, it's imperative to rule out a teratoma either with a CT or MRI abdomen. The next one is Ophelia syndrome. So before we go into Ophelia syndrome, a bit about the history. What is Ophelia? Ophelia is basically the female character, the girl who loves Hamlet in the Shakespeare play Hamlet. If you don't know about Hamlet, you must have watched Heather. And in Heather, the girl who loves Shahid Kapoor, she in the end goes mad. And that's what happened with Ophelia as well. She ends up going mad. So Ophelia syndrome is nothing but something related to, as we can say, madness. So Divya will elaborate now.
So the madness here is suggesting that there is something limbic system involvement. So it's basically limbic encephalitis, and as you all know that limbic system is very important for our memory consolidations, emotions, and processing of the information, recent memory, past memory. So there would be memory loss, confusion, and also the child might have seizure like activity, and that's it. That's Ophelia syndrome.
Yeah, so the Ophelia syndrome, limbic encephalitis can actually be the paraneoplastic syndrome of a lot of malignancies, including small cell lung cancers, including your breast malignancies, and including your other non-Hodgkin's lymphoma. But by Ophelia syndrome specifically is referred to as the paraneoplastic limbic encephalitis of Hodgkin's lymphoma, one of the commonest malignancies in children. So if a Hodgkin's lymphoma child presents to you with the symptoms like she said, memory loss, confusion or things like, then you can have a diagnosis of Ophelia syndrome, and nowadays it has been recognized it's caused by an autoantibody against the glutamate receptor, that is the anti-GLUR5 antibody. I hope you like the session, and I'm glad that I'm again back with Divya. And if you like the channel, if you like our videos, do not share to like and subscribe and share the channel. And she also, by the way, loves to teach. You can follow her on Instagram, you can follow her on YouTube. The links will be there in the description, so don't forget that. Goodbye.